India so far. What an amazing atmosphere here, though, today, to be honest. I think this is already, I know, this is the best crowd so far. We've had some amazing crowds. So over the next 40 or 45 minutes or so, the title of my talk today is Curing the Pandemic of Misinformation on COVID Vaccines Through Real Evidence-Based Medicine. Can you see it from the back? You can see? Yeah? So the first question really we have to ask ourselves, and somebody like me who's a cardiologist, who is an advocate of evidence-based medicine, who's well published, who doesn't have any commercial influence with my with my research. Why, when the evidence is so clear, it's not even debatable that these vaccines should be stopped and probably shouldn't have been rolled out in the first place, and I'll go through the evidence with you shortly on that. Why is this not being disseminated through to the masses, right? You are an awakened crowd. It's exactly the right way to describe awakened India. You are awakened, you're enlightened, you are closer to the truth than the majority of people in the world right now when it comes to the vaccines, right? So the question is why? And the barrier to the dissemination of the truth to the masses is not so much an intellectual one, it's a psychological one. That's the key barrier, right? And I'll explain there are 3 psychological barriers we need to overcome if we are going to ultimately win this information warfare against these big, powerful corporations. And the first psychological barrier is something called willful blindness. So this is something that we're all capable of in different circumstances, even in our own family environments, even, for example, a spouse turning a blind eye to the affair that they're having, right? This is something that's inbuilt within human beings. And it's defined as when human beings, when people turn a blind eye to the truth in order to feel safe, avoid conflict, reduce anxiety, and protect prestige and reputations. So that's the first barrier. The second barrier we're dealing with is one of fear, which was created by the pandemic. And when people are under a state of fear, it inhibits our ability to engage in critical thinking. And that's really important right now for people to engage in critical thinking. And the third barrier is very much a human-like state where, changing one's mind is one of the most terrifying experiences a human being can go through. And in academia, there's a great quote from John Kenneth Galbraith, a Canadian-American economist, is that faced with the choice between changing one's mind and proving there's no reason to do so, almost everybody gets busy on the proof, right? So we have to understand what these barriers are and acknowledge them, and then we have to then communicate with people who are not enlightened like we are in a compassionate way, right? I think that is really the way that we can win this. So what's worse than ignorance, the late great Stephen Hawking, which actually is really just an evolution of thoughts of Buddhism, of the Buddha, right? What's worse than ignorance? The illusion of knowledge. Let's start by defining what we ultimately is most important to us. Okay? When you look at international surveys, OECD international surveys, the single most important thing that is the factor that is important to human beings actually is their health, right? And then it's followed by a happy family environment. So the health is the most important for people. And the World Health Organization, who, understandably are not in the good books of many people right now, they actually have a very good definition for health, and it's this. It's a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. You can't have optimal physical health without having optimal mental health. You can't have optimal mental health without having optimal physical health. So I published this article in the Journal of Insulin Resistance towards the end of last year, and I spent a long time writing it, and I wanted to really break down the data on the issues pertaining the Pfizer COVID mRNA vaccines initially, but also how we got it wrong, why we got it wrong, and what the solutions are moving forward. I didn't just identify the problem, I went into the root cause, right? And without understanding the root cause of any situation, any issue, without understanding the root of the problem, any solutions you offer are going to be flawed. So we have to go to the root of the root, the causes of the causes, which I'm going to take you through very in the next half an hour or so. So let's start with something which I love, which is a very elegant, simple framework for teaching and practicing medicine. It's called the evidence-based medicine triad. And what we aim to do as doctors is improve our patient outcomes. So what does that mean? Managing risks, treating illness, or, very important in a lot of what we do in medicine, is relieving suffering or improving quality of life. And we do using our clinical expertise, our experience, the best available evidence from research, and taking into consideration patient preferences and values. But if the best available evidence is corrupted by commercial influence, which unfortunately it has been, then doctors are making decisions for patients on biased information, and then at best we're going to get suboptimal outcomes, and at worst we're going to do harm. And unfortunately, the state of affairs even prior to the COVID pandemic suggested that evidence-based medicine has become an illusion, and it's become hijacked by very powerful commercial entities. And what happens as a result of that is that we create an epidemic, or in fact I would say a pandemic, of misinformed doctors and misinformed and unwittingly harmed patients based upon a number of factors, which are biased funding of research. Research that's funded because it's likely to be profitable, not because it's beneficial to patients. Biased reporting in medical journals. Biased patient pamphlets, biased reporting in the media. That's a big, big factor for health misinformation. Commercial conflicts of interest, of course, defensive medicine, and last but not least, medical curricula that fail to teach doctors how to comprehend and then communicate health statistics. Without understanding the numbers involved, doctors, patients, and the public are vulnerable to exploitation of their hopes and fears by commercial and political interests. And we've seen that throughout the pandemic. Even the risk of COVID, I know in the lovely video that was shown earlier, there was a discussion about whether this was really a pandemic, what was the mortality rate. And I think that there is a point to be made there. Because one survey in America early on in the pandemic, of 50% of Americans thought their risk of being hospitalized with COVID, if they contracted it, was 50%. They thought there was a 1 in 2 chance they were going to be hospitalized, when the actual figure was close to 1 in 1,000. Right? So think about how that level of misinformation creates so much fear that then drives everything else that we do, whether it's compulsion of mask wearing, which we now know essentially has been a complete waste of time. Masks haven't been shown to show any significant impact. All of this was from understanding the numbers is really crucial here, and it's not complicated. I'm going to show you why it's not complicated as well. John Ioannidis is the guy that I describe as a Stephen Hawking-like figure in medicine, professor of medicine and statistics in the University of Stanford. And he wrote this wonderful paper a few years ago, which is called How to Survive the Medical Misinformation Mess. And he says most doctors are not aware of the poor quality research that drives overuse of medications, underuse of maybe cheaper, safer options, lifestyle changes, waste in the healthcare system, avoidable harm, adverse events, and missed opportunities for treating the right patient at the right time with the right drugs, right? And most doctors are unaware of this. And of course, in America, many people in India, of course, there are different issues, different priorities in India, of course, in population health in many ways. But if you think about America, which is the richest nation on earth, 30 to 50% of all healthcare expenditure in America brings no benefit to the patient. They spend almost $4 trillion on healthcare expenditure in the United States, and they have some of the worst health outcomes in all the developed countries, right? And we know why, and I'll explain it. So, what Ioannidis says is much published research is not reliable, and therefore, and not useful to decision makers, and offers no benefit to patients. Most healthcare professionals are not aware of the problem. Coming back to what I said earlier, the illusion of knowledge. Most doctors do not know this. Most doctors do not know this. And if the doctors don't know it, how do we expect the patients to know that? The doctors also lack necessary skills to evaluate how reliable the research studies are, and then they can't then communicate that information to patients and families who then lack that level of information that they need to make decisions about anything to do with their health. And I've learned as a cardiologist, practicing doctor for over 20 years, somebody who's also been involved in health policy, who's met politicians, who's worked on health advisory boards, and met some very eminent people. Ignorance of this problem, which I've described, and Ioannidis describes it as well, is actually, even at the very highest levels of academic and clinical leadership, it's very profound. And a couple of good examples of this I will give you. So when Rochelle Walensky, the former chair of the CDC in America, when all of the information on the vaccine started to emerge, that it wasn't stopping transmission, it wasn't stopping infection, she gave an interview and she said her optimism from the vaccine came from CNN, okay? Came from a CNN news report, which ultimately, that CNN news report she referred to was a verbatim reproduction of Pfizer's own press release. The chairman of the BMA, who I know, Char Nagpal, and I had conversations with him, he also said to me, when I spoke to him about the vaccine, after I'd critically analyzed the data, and he said to me, Aseem, no one appears, and he's obviously at a level where he's speaking to chief medical officer and people in health policy, he said, nobody seems to have critically appraised the evidence as well as you have, Aseem. Most of my colleagues are getting their information on the vaccine from the BBC, okay? So this is unfortunately the reality we face, but it also tells you the power of media, right? Which we'll come on to. And the other interesting thing Ioannidis says, he says the greater the, and so he's also a mathematician. I mean, he's a brilliant mind. You know, he's the most cited medical scientist in the world. And he wrote this paper in 2001 in PLOS ONE, which was entitled Why Most Published Research Findings Are False. And he says the greater the financial and other interests and prejudices in a scientific field, the less likely the research findings are to be true. Okay? So if you look, for example, at the Pfizer vaccine here, and I'll elaborate in more detail shortly, we have a vaccine that is probably one of the worst in terms of efficacy, all right, in terms of benefit, the worst in terms of side effects, which has ultimately become one of the most lucrative in the history of medicine, right? We're talking almost $100 billion that Pfizer have made from something that is just terrible. That really explains the system failure that we're facing. So let's just state some very clear, important facts that people need to understand in doctors. So there's a long history, certainly in the last couple of decades, where most of the top 10 drug companies have been found guilty of committing fraud. So between 2009, 2014, total fines from fraud because of the pharmaceutical industry, misdemeanors, totaled about 13 to 14 billion US dollars for hiding data unharmed, illegal marketing of drugs, manipulation of results of data. And Peter Gosha, who's a co-founder of the prestigious independent Cochrane collaboration, in this BMJ article, he says that when they commit these, when they're found guilty to commit these frauds and these crimes, nothing changes in the system to prevent this happening again. Often what happens is the drug companies end up making more in profit from illegal marketing of drugs and fraud or whatever else, than, significantly more in profit than what they end up paying in the fines. And he says, if crime pays, you commit more crime. And that's exactly what's happening. So he suggests, and I agree with him on this, he said it's time to introduce tougher sanctions as the number of crimes, not the detection rate, seems to be increasing. Right? He wrote this in 2014. He said, fines need to be so large that companies risk going bankrupt. Top executives should be held personally accountable so that they would need to think of the risk of imprisonment when they consider performing or acquiescing in these crimes. Now, when I spoke yesterday in KDH Hospital, one of the doctors there made an important point, and I think we should address this. This is not about throwing the baby out with the bathwater. It's not saying all drugs are terrible, medicine is terrible. Absolutely not. This is about the excesses and manipulations. And of course, one would say, yes, modern medicine has achieved a lot, right? It produces life-saving drugs. We have many things, antibiotics. But another myth I'm going to bust for you, and I remember giving this talk in the University of Stanford to medical students a few years ago, and they were quite shocked. They didn't know this. When you look in the Western world, an increase in life expectancy, from 1850 to now, there's been about 40-year increase in life expectancy. Okay, average life expectancy in 1850, in say in the UK or the USA, was 40 years old, right? Now we're saying it's about 80. So the question is, how much role did modern medicine play, do you think, in that increase in life expectancy? How many years did it add? Now, when they did a survey, there was a study that was published for educated American adults, right? Almost everybody, the average increase in life expectancy, they thought 80% of those 40 years, 32 years, was because of modern medicine. That's what the public believed, educated public. Do you know what the real figure is? It's about 3.5 years. Modern medicine has achieved a lot, but let's put things in perspective here. right? So what is really behind the increase in life expectancy? Public health interventions, safe drinking water, seatbelts in cars, smoke-free buildings, safer working environments. This is what has been behind it, right? So good health doesn't come out of a medicine bottle, right? That's what you need to understand. Now, what about the net effect? So, okay, well, the pharmaceutical industry often are producing some great drugs. Of course, we know that. We believe that to be true. But how good is their overall effect? So this is an analysis done in France, and this has been repeated in other countries between 2002 and 2011, of almost 1,000 drugs that were approved by the regulator in France. More than half of them were found to be copies of old ones. So what happens is the drug companies, they basically change a few molecules here and there. They pretend to the regulators and the public it's a new drug. They change the name. It's exactly the same. They patent it. They make money. And this carries on creating waste in the system, because ultimately the public and governments are paying for this, right? So it's waste. But then what they also found was there was 15.6% of those 1,000 drugs were found to be more harmful than beneficial after they were approved. And 8% were only of increased therapeutic value. In other words, only 8% of the drugs of 1,000 were thought to be better than pre-existing drugs. But double the amount were more harmful. So what does that mean? When you look at that data, it's very clear. The overall net effect of the pharmaceutical industry on society in the last few decades has been negative, negative, negative. This is not just in in France. We know that in the United States, very similar figures there. Marcia Angel, the former editor of the New England Journal of Medicine, she said, "It is no longer possible to trust much of the clinical research that is published or to rely on the judgment of trusted physicians or authoritative medical guidelines. I take no pleasure in this conclusion, which I reached slowly and reluctantly over my 2 decades as an editor of the New England Journal of Medicine, which is considered the highest impact medical journal in the world." Richard Horton, editor of The Lancet, he said a few years ago in an online editorial, "Possibly half of the published literature may simply be untrue." And then, of course, research misconduct is a big problem. Richard Smith, former editor of the BMJ, he wrote as well, not so long ago in the BMJ, that he attended a meeting with lots of academics in British institutions, Oxford, Cambridge, whatever, and he asked the audience, how many of you are aware of research misconduct or fraud being committed in your own department, in your career? 1/3 of the people put their hands up, 1/3, right? He then said, how many of you reported this fraud? Everybody put their hand down. So there's a cultural problem here too, which we'll go into the roots of this cultural problem. And then one of the worst cases I've ever read about of fraud or research misconduct was actually committed by a Dutch researcher whose work on the use of beta blocker drugs, okay, in non-cardiac surgery influenced European Society Cardiology guidelines. He produced scores of papers, and it was estimated, eventually it was found that he committed fraud. He completely fiddled the data. There was no benefit from beta blockers in this situation. And it was estimated, because of this single individual's fraud, there may have been an excess of 800,000 deaths in Europe over a 10-year period. This is one person. Now, why was this not world news when it happened, right? Most people don't know about this, okay? But this is a fact. So as a cardiologist, as a clinical doctor who only cares about doing best for my patients, I became aware, probably over a period of 10 years since I qualified in 2001, that I was noticing and observing as a doctor in the National Health Service, more and more people coming in with chronic diseases, more and more people taking more medications. We weren't making people better. Population health seemed to be getting worse. In the UK, for example, our life expectancy has now stalled since 2010, and more people are living longer with chronic disease, right? So our health in these Western so-called developed countries is getting worse. It's regressing. It's not getting better. United States is now seeing a decline in life expectancy. So, aware of all of this and my own investigations to get to the root causes, I realized also there was a big problem. Obviously, there was a massive problem with diet-related disease, which I'll talk about briefly shortly. But there was a big problem with over-medicated society, and one estimate suggested that the 3rd most common cause of death globally after heart disease and cancer now is prescribed medications, what your doctor prescribes for you, because of side effects that are usually avoidable, right? So in my private advocacy work, I was invited to be a consultant to the Medical Royal Colleges when I was just becoming a consultant cardiologist myself. And the Medical Royal Colleges essentially represent every doctor in the UK, Royal College of Physicians, Royal College of Surgeons, obstetrics, all of that, pediatrics. And I convinced those Royal College presidents that the medical profession needs to launch a campaign to wind back the harms of too much medicine in conjunction with the BMJ, a medical journal that had started a campaign like this in 2012. And I was lead author in this paper, and you can look it up. And some of the co-authors here include some of the most eminent doctors in the UK. And you know, a lot of, and it was really just to highlight, and this became a big news story, you know, it was at least one day's news to start with. It was all over the news. And one of the other problems as well in a healthcare system, when a lot of doctors are doing things that aren't beneficial, and they don't even know it, then it creates a lot of waste, right? And then, you know, it diverts from the patients that need it. So one doctor's waste becomes another patient's delay. So let's talk about misleading health statistics, because I think one of the most important educational aspects, if you like, I think, from this talk, and anything we do in medicine, comes down to understanding the numbers in a way, you know, explaining the numbers as a doctor in the way that most people can understand, and this is not rocket science, okay? So let's look at misleading health statistics. And this is very relevant to the vaccine as well. So there are many ways of presenting a benefit. We use something called relative risk or absolute risk. If you use relative risk, then it can mislead doctors and lay people to exaggerate the benefits of a treatment, as opposed to using what should be more honest, which is the absolute risk reduction. So I'll give you an example. If you look at the use of cholesterol-lowering statin drugs in people who have type 2 diabetes, the relative risk reduction from the trials is 48% in terms of preventing a stroke. Now that sounds quite impressive. If a patient comes to me in the consultation room who's got type 2 diabetes, I can say, and this is often what happens when cardiologists are doing this, if you take this pill for the next 4 years religiously, you're 48% less likely to have a stroke. Okay? You're 48% less likely to have a stroke. Now that sounds very impressive, but that's using relative risk. What does it actually mean in individual terms? Well, if you look at the trial on which that information comes from, the randomized control trial, it essentially means that you're reducing the risk of having a stroke from 28 in 1,000. So this is people who took the dummy pill and were followed up over 4 years. Out of 1,000 people in the dummy pill, 28 people had a stroke. And then you follow up a similar group of people, 1,000 people over 4 years, who are matched with the control group, and you give them the statin pill. And only 15 of those had a stroke out of 1,000. Yeah? So what you've done is you've prevented 13 people having a stroke out of 1,000 people that have been treated. Yeah? 13 over 28 times 100 is 48%, right? Relative risk reduction. But the absolute risk reduction, the real risk reduction for that individual, is 1.3%. Yeah? 1.3%. Another way of saying that is 1.3% is 1 in 77. Okay? So what we should be telling patients in absolute terms, and it's something I do very consistently now when the information is available, I say to the patient, if you take this pill religiously every day for the next 4 years, there's a 1 in 77 chance it will prevent you having a stroke. Now that doesn't sound very impressive for a lot of people, does it? In fact, but this is what we should be telling patients. That's what the clinical trial data tells us. And by the way, that's if we believe that trial data to be true. This is still likely an exaggeration. You know, and this is part of what we call ethical medical practice, shared decision making. This is also part of what we should be telling patients. We call this element of uncertainty, right? In medicine, there's always going to be some element of uncertainty. We should tell patients that. I always tell them that. I say, by the way, the information I'm giving you comes from industry-sponsored trials where they've held onto the raw data. So this is likely best case scenario for you. And then I let the patient decide. Now, the patient may decide themselves, you know, they may be good, I'm not going to take that, that doesn't sound very good, is there anything else I can do? Or they may say, doctor, I'm not sure, what do you think? Right? And that's fine. You know, there's different ways of responding to that. Now, the problem is, when you look at this relative risk and absolute risk, many medical journals over the years have used mismatch framing, so they present the benefits of a drug in the clinical trial, in the Lancet or the BMJ, in relative risk terms, and the harms in absolute risk terms. Which is a joke, really. This is not medical science. This is marketing. A third of articles published in the BMJ, JAMA, and the Lancet between 2004 and 2006 use this mismatch framing. So they're exaggerating the benefits in people's minds and minimizing the harms. don't just take my word for it. This is a WHO, World Health Organization bulletin, which was written by the director of health literacy in the Max Planck Institute in Berlin, Gerd Gigerenzer, who I've also met, wonderful man. And he wrote this. This is not just my view. He said, it is an ethical imperative that every doctor and patient understand the difference between absolute and relative risks to protect patients against unnecessary anxiety and manipulation. In other words, and I've argued this, I say, if a doctor is not telling patients the absolute risk of any intervention when that information is available, it is unethical medical practice. It is unethical medical practice. So let's just briefly sidestep for a second and talk about the link between poor diet, for example, and COVID. Now, all around the world, certainly very early on, I noticed when in 2020, when information started coming from Italy and from China, that there was a clear link between, once you exclude age, very elderly people, because remember the average age of death, interestingly, at the beginning of Italians, right? I remember writing about this. The average age of death from COVID was 81, and the average number of comorbidities, other conditions they had, was 2.7, something like that, right? So clearly it was predicated on the vulnerable and the elderly. But after age, obesity was the biggest risk factor. And I was getting very frustrated because I know from my own research and my own practice with patients that dietary changes can very rapidly improve people's risk factors for heart disease, but also very likely improve their resilience to infection, even within just a few weeks. And I wrote this article ultimately in European Scientist called COVID-19 in the Elephant Room, went viral, broke records or whatever, because I think a lot of people were frustrated that, in terms of the lifestyle medicine and that kind of space, so why were the government, why was it not coming through in the media constantly when, obviously this is way before we had a vaccine. Why were they not using this as an opportunity to say, listen, we have diet-related disease, just by the way, the Lancet Global Burden of Disease reports tells us that poor diet is responsible for more disease and death globally than physical inactivity, smoking, and alcohol combined now, right? This is the big public health crisis, is people's diets. And Indian diets, I know in general, I've studied a little bit of that. I come from an Indian background as well. There's a very high sugar, very high refined carbohydrate diet, and that's a big issue. But what's good is that you can rapidly improve your health just within a few weeks of changing diet. So I wrote about that, and then I published this article in the journal Physician. And just to give you, just to highlight the problem in terms of, especially amongst Indians, but really around the world, we should be focusing on something called metabolic syndrome or metabolic health. And this basically includes whether you're a pre-diabetic or diabetic, whether you have high blood pressure, blood triglycerides and HDL, and a waist circumference. And the reason I've put this up is that you can revert, the worst form of metabolic health is something called metabolic syndrome, when 3 of these are abnormal. And this is a big problem in India, 40% of people with a normal body mass index who think they are slim, right, actually have metabolic syndrome. And this is very problematic in India and increases the risk of heart attack and stroke. But the reason I'm telling you this is there is reasonable data now that you can reverse metabolic syndrome. You can reverse metabolic syndrome within 1 month, 28 days of just changing diet, right? Just changing diet. And this doesn't involve drugs, and it's not expensive, okay? But this is the kind of message that we need to be thinking about moving forward. And of course, when it came to COVID, and I wrote a book about it, on immunity, there was a huge predilection for people's risk if they had metabolic syndrome. So you're 4 to 5 time fold increased risk of ending up in the ICU if you had metabolic syndrome. And of course, this was a major issue in India. And this is worse than even obesity. And one simple thing you can do, again, I think this is a very cheap way of educating people, is looking at people's waist circumference, okay? And your waist circumference, everyone can measure this at the belly, should be, I know people are pointing at each other's bellies over here, it's quite fun. Your waist circumference should be less than half your height. So let's say, for example, if you are 160 centimeters, you want your waist circumference to be less than 80 centimeters. But with my practice with patients as well, it honestly doesn't take that long to people to get to that stage, and it doesn't mean you have to spend hours in the gym. I'm not advocating this because I think exercise is good, but you can lose a lot of weight literally just by sitting on the couch and changing what you eat, right? That's all you need to do. So I then, I got very frustrated. I started writing articles and getting some publicity and stuff. And then I wrote an article which featured on the front page of the Daily Telegraph, which is a very, impactful newspaper in the UK. And I mentioned the fact that ultra-processed food also sets you up for inflammation. There's a lot of data now emerging. This is going to be the next big issue, is ultra-processed food, right? And it sets up, basically there's chronic inflammation, which also causes dysregulated immune system. Excess body fat also is linked to a dysregulated immune system. So we need to be focusing on that moving forward, even for other infections, other viruses. If you are metabolically healthy, you basically get better quicker when you have viruses, and you're less likely to get infection. If you get infection, you will also recover more quickly. So this is also one of the best defenses, if you like, against coronaviruses, is improving metabolic health. And then when I wrote the article in the Telegraph, they then asked me to go on BBC News and Good Morning Britain. I talked about it, and then I said, by the way, I threw this in there, I think our Prime Minister, he'd been hospitalized and come out of hospital by that stage, Boris Johnson, who was quite overweight, and I knew people that knew him well, etc. And I said it compassionately. I said, it's likely our Prime Minister, Boris Johnson, was hospitalized with COVID because he was, he was 18 stone. He was very overweight. And then the Times newspaper the next day, actually, I didn't expect this to happen. Because of what I said, they then headlined with this, right? So, anyway. I then got contacted by the Secretary for Health, Matt Hancock, to advise him on what we need to do to tackle obesity. And I said, Matt, we need to treat ultra-processed food. People need to understand what it is, and we need to treat it like we treated tobacco. We need policy changes that are going to help and encourage people to eat healthier through education, through raising the price of ultra-processed food, by making healthier foods cheaper. This is what we need to do. And then they came out not long after I advised him, and they said they were going to, launch because of his, he then acknowledged it, actually, Boris. He said, yeah. Probably because of my weight, I got sick. I acknowledged it, and and he said that we're going to launch this war on fat after the virus scare. Politicians, they say a lot of things, right? But the question is, we should judge them on their actions, not what they say. Unfortunately, nothing has really been implemented. All of this is rhetoric. And then we then know now that 90% of the deaths from COVID happen in countries where more than 50% of the population are overweight or obese. If you look at countries like Japan or South Korea, for example. They did not have big, high mortality rates from COVID, some of the African countries. And I'm sure one of the reasons for that is because they generally were slimmer and healthier. Okay, let's just talk through the vaccine. I know a lot of you are already kind of converted, but I'm just going to go through this story again. I did not believe, and still don't believe, although I know there are a few vaccine skeptics here in the audience, and I think that's a discussion for maybe later on. But certainly when you look at all the drugs that all the pharmacological interventions we have used in medicine, vaccines are still amongst the safest. And responsible for probably saving 4 to 5 million lives a year globally. Traditional vaccines, right? And I did not think that a vaccine could do any harm. And I was one of the first to have 2 doses of the Pfizer vaccine in January 2021. I convinced my friend, you may know of her, Gurinder Chadha, who's a film director. She was getting a lot of what I thought was anti-vax nonsense sent to her. And I said, Gurinder, no, the vaccine, I'm not convinced. I can't tell you for sure how efficacious it's going to be, but I'm sure it's not going to cause you any harm. She then tweeted it out, and then we went on Good Morning Britain to tackle vaccine hesitancy in February 2021. I also helped, and he's happy for me to share this with you, I encouraged and helped also Shekhar Kapoor, who's a good friend of mine, the film director who was in London at the time, to get the vaccine as well. Of course, by the way, just to let you know, they're not having it anymore, right? They're done. They know what I've been talking about. Gurinder's even tweeted, I'm not having any more boosters or vaccines. Shekhar's also in the same boat, and he's happy for me to share that with you because of what I've told him. And then we move forward. So at that time, the data was very limited. I know a lot of you intuitively didn't take the vaccine, and your intuition was correct, right? Your intuition was correct. People ask me why I took it. I'm the biggest, probably the most vocal advocate maybe in the world in the last 10 years, calling out pharmaceutical industry corruption in terms of mainstream media all over the world. Why did I take it? It's complicated. It's complicated. I could have waited. I was young. I knew my risk was low. I even did analysis on COVID risk. But, my father was a prominent doctor. He was, I think to some degree, and some of us here, some of the people here may also have felt that there was an emotional blackmail type thing going on. And he was very scared. I lost my brother when I was young. I was his only son. He lost his wife 2 years before. He was more scared of me dying from COVID than him himself. What does that tell you? And this is a very bright chap. The fear gripped so many people, even the brightest minds. So I kind of did it to appease him. The reason I took the vaccine, I could have waited. The main reason is initially I did it to appease him. Okay. So then July 2021, he suffers a cardiac arrest and dies suddenly. I couldn't explain how, why he died. He was a very fit guy. Post-mortem findings showed 2 severe narrowings in his coronary arteries. Again, didn't make sense. I knew his lifestyle. I knew his risk factors. I knew his cardiac status. This guy was a very, very fit guy, and it didn't make any sense to me. And then several months later, data started to emerge that then made me think differently. And the first thing that happened was there was a publication in an American journal which suggested that the vaccine could be accelerating heart disease by increasing inflammatory markers in the blood. And that was the first time I thought, okay, now there's an explanation of what happened to Dad. That's the first bit of information. But as a good scientist, you never rely on one bit of data. These sometimes are hypothesis generating, or it could be, by chance or whatever else. But the data looked quite clear, even from that small study. It looked like, okay, the vaccine is accelerating inflammation in the body, and it's particularly bad for the heart. The second bit of information came when I was contacted by a cardiologist, a researcher in a very prestigious institution in the UK, somebody I know very well, very high integrity, one of the smartest cardiologists I know, a colleague of mine. He's a PhD, and he said to me, Aseem, there's something troubling I need to share with you. I said, what is it? He said, a group of researchers in this institution have accidentally found, using coronary imaging, specialized, very high-tech coronary imaging, that there is increased inflammation in the coronary arteries in the vaccinated, and it's not there in the unvaccinated. But they then had a meeting and they said, we're not going to publish our findings because it could threaten our funding from the drug industry. I then went on GB News. This time, I remember going there, I was a little bit nervous, but sometimes, a little bit of fear is not necessarily a bad thing. It's about conquering your fears, and I thought, this could backfire. And I went on GB News and I told them I'm going to talk about something, that, this new data, and we should have a discussion. And I didn't say, at that stage, I didn't say stop the vaccine rollout. I said, this is concerning findings and it needs to be investigated. After I did this interview, about a week later, this went viral, right? That same researcher contacted me and said, you won't believe what's happened. All the cardiologists, a lot of them have seen your video now. They've had another meeting. They've got 15 to 20 researchers in that group in a room, and they've asked them to sign non-disclosure agreements. Right? This is unheard of. Unheard of. So I did this interview, and then behind the scenes, and this will probably come out at a later stage in a book or whatever I write, I had a lot of stuff to deal with. One prestigious institution I was affiliated with got a lot of anonymous complaints from doctors. Who is this anti-vaxxer spreading disinformation? I had to defend myself. I spent a month doing that. I was actually, still grieving, obviously loss of my dad. It was bad timing. But the reason I'm telling you this is I realized at that point, and I thought, I'm going to have to critically appraise the evidence. And I can't just go out on Twitter and social media because, I could get in big trouble. So I thought the only way I can do this, and even now it's a challenge, the only way we can really potentially win this is I critically analyze the data, and then I publish it in a medical journal. And I said to myself, when I publish it, right, which happened last September, and I was looking at this for about a year and a half, right, before then. When I publish it, I'm going to unleash like I've never unleashed before, right, on this, citing the research and peer-reviewed research, right? And I'm staying true to that. And I'm also doing it partly because I realized that my father probably was killed by the vaccine, and I'm his only advocate. He's the last surviving member of my immediate family. I'm his only advocate. So that's why, that also gives me that passion and drive to carry on. So let's just break down the data for you, right? Absolute risk reduction, remember that. So I thought, okay, the first thing I'm going to do is let me go back to the original trials of Pfizer and Moderna, and let me see what was the absolute risk reduction. Because the reason we're looking at absolute risk reduction here in these terms is that by that stage, we knew that the vaccine was not preventing transmission or infection. The narrative changed, yeah? First, we said it was going to be 100% effective against infection. We knew that was nonsense from real-world data. Then they said, okay, it won't prevent you getting infected, but it'll prevent you dying, right? Everything kept changing constantly. So I said, okay, we now see it as a prophylactic drug, right? So we can then calculate. So I went back to the original trial of Pfizer and Moderna, and basically we find that the absolute risk reduction from prevention of infection, because that's the only thing that came from that trial, was 1 in 119. So it was a 95% relative risk reduction, but the absolute individual reduction of preventing infection was 0.84%. You have to vaccinate 119 people to prevent one person being infected, right? If that was true, and there's a reason to suggest, by the way, it may not have been true even at the beginning, But also what's interesting, this is quite a large, 37,000 people to 40,000 people in this trial. They did not show in the randomized control trial, highest quality level of evidence, they did not show any statistically significant reduction in COVID mortality. Which is interesting, right? Because what that means is, even then as a doctor and as somebody who knows about evidence-based medicine, it means that if there is a benefit in reducing from COVID deaths, it's going to be very, very small, right? That's the first thing. The next thing, people will say, what about antibodies? We were getting tested for antibodies. We know with I've been vaccinated, lots of vaccines, smallpox, hepatitis B, whatever. If you've got antibodies, you are protected from infection. You know, you vaccinate 100 people against smallpox, 95 of those will not get infected, right? But we know that a surrogate, which is very useful, traditional with other vaccines, are antibodies. But there's a problem here. We also believe that antibodies that were generated from the COVID vaccines would give us protection. But the FDA, again, it wasn't publicized in the news, but this is from the FDA when in June 2021, they actually stated on the website, you can look this up, you know, basically the public and healthcare providers must understand that current antibody tests for SARS-CoV-2 should not be used to evaluate a person's level of immunity or protection from COVID-19 at any time, and especially after the person has received a COVID-19 vaccination. Most doctors don't know this. I remember when I started doing this research and I was ringing up public health doctors and stuff, they were shocked. What? What do you mean? They didn't know. These are people who are going on TV and telling people to take the vaccine. They didn't know this. They didn't know these basics. So what is the benefit of the vaccine, right? Only 2 weeks ago, the UK, and this is the only country in the world that has done this, by the way. The Americans are a bit opaque with their data. They were able to look in the real world at 1 million vaccinated versus unvaccinated to see what the potential benefit of the vaccine is. Now, this is not the perfect data because there are lots of other factors that play in, but it gives you a rough idea, okay, on the benefit. And here we go. Are you ready? Okay, this is just published from UK government. If you're over 70, having had 2 doses of the Pfizer vaccine, you have to vaccinate 2,500 people to prevent 1 hospitalization with COVID. If you're 60 to 69, 5,700, 50 to 50, I mean, these figures are just ridiculous. These figures are ridiculous, right? Hundreds of thousands of people have to be vaccinated. So imagine from an informed consent perspective, imagine a 70-year-old person coming to me, if this conversation was to happen, doctor, should I have the vaccine? Well, I'm going to help you make that decision. If you take this vaccine, there's a 1 in 2,500 chance it's going to prevent you being hospitalized with COVID. How many people would take a vaccine on those benefits? Nobody would take it, right? Now, okay, on a population level, you could argue if there's no harm, fine. There's no harm, there's some small benefit, vaccinate everybody, right? But unfortunately, nothing could be further from the truth, and I'll come on to the harms in a second. So, we've talked already about the influence of media on us. Right? Let's not deny that mainstream media has a huge impact on the way we think, what we choose to buy, our health information, drugs, etc., even for doctors. And the first thing is, JAMA published a paper a few years ago to look at the accuracy of reporting in mainstream media on medical stories in the USA. And they found that basically the majority of healthcare stories that were reported between 2006 and 2013 did not fulfill criteria for accuracy, and out of 5 or 10 criteria, right? And basically, the upshot was this: that most healthcare stories reported in the media were essentially false. They were nothing, or not even close to the truth, right? Now, let me give you an example, because this is also important. Many people who are arguing against what we are trying to say keep saying that the heart attacks are because of COVID and mild COVID and all this kind of stuff. And I understand why. The Times newspaper themselves, only a couple of months ago, headlined with this: even mild COVID linked to heart disease and strokes, right? Now, a general practitioner who I knew, who read my paper, who was on my side, even he was taking, said, Aseem, are you sure you're right about the vaccine causing problems? Are you sure it's not COVID? I said, what do you mean? He said, have you seen the Times today? This is a very well-known GP, general practitioner in the UK, smart guy, okay? He just read the headline and believed that to be true. So I thought, okay, let me look at the research paper on which this headline is based to see, is this correct? What does it mean, mild COVID, and who, and, let me go into the details on it. So it's published in BMJ Heart. The first thing, I went to the conclusions and I looked in the original paper and read through it properly. And what they concluded is that individuals who are hospitalized with COVID, so these are people with severe COVID, yes, with severe COVID, certainly, and within the first month during the original Wuhan strain, within the first month after discharge, there was an increased risk of heart attack and stroke. Fine. We kind of know that anyway. In any severe condition you have, you know that as doctors, right? If you come in with an illness and you have an underlying predisposition to heart disease, those people can often have heart attacks. There's nothing new there. Any stress on the body can precipitate that, right? So nothing quite new there. But what they also said in the conclusions, individuals not requiring hospitalization had an increased risk of a pulmonary embolism, a lung clot, right? But not other cardiovascular specific outcomes. In other words, if you had mild COVID, if you weren't hospitalized with COVID, there was no link to heart attack and strokes, right? No link. But the headline said this: even mild COVID linked to heart disease and strokes. Complete nonsense. What's even worse, when I read the paper, I found this. In our main analysis, we found an unexpected finding that COVID-19 was associated with a lower risk of heart attack in non-hospitalized subset. In other words, if you had mild COVID, you were less likely to have a heart attack. The headline should have been that. Mild COVID linked to less risk of heart attack. They did the opposite. Can we trust the regulators? Right? We would hope that our regulators would be doing their job properly. And the BMJ did an investigation again last year, and they looked at funding of the regulators, and unfortunately, most of the regulators around the world in these Western European countries get their funding from pharma. FDA gets 65%. The regulator in the UK gets 86%. Even I was shocked to learn this. And Donald Light sums it up very perfectly, which I'll do that for you now. It's the opposite of having a trustworthy organization independently and rigorously assessing medicines. They're not rigorous, they're not independent, they are selective, and they withhold data. Doctors and patients must appreciate how deeply and extensively drug regulators cannot be trusted so long as they're captured by industry funding. Okay, let's talk about the harms in absolute terms. What's the best available evidence? Of course, the randomized controlled trial. So there was a reanalysis done of Pfizer and Moderna's randomized controlled trial by independent researchers who were able to gather new data, okay, this wasn't fully made apparent at the beginning when the vaccine was rolled out, and they published it in the journal Vaccine. It was peer-reviewed. They're independent of commercial influence. They're very eminent scientists, and they found that the rate of serious adverse effects from the vaccine was at least 1 in 800, okay, in the first 2 months of the trial. That means disability, life-changing event, hospitalization, and this is a crucial part. You were more likely from the original trial to suffer a serious adverse event from COVID than you were to be hospitalized. Serious adverse event from the vaccine than you were to be hospitalized with COVID. So from the beginning, it suggests the vaccine was going to do more harm than good. What does that mean? It probably should never have been approved for anybody in the first place. Okay? And the World Health Organization, again, this is information that's available but will not publicized. They also suggested, they came out with a list of what could go wrong with the vaccine, with the COVID vaccine, when it was approved. And anything and everything that could go wrong with the heart is on that list. It's horrendous, honestly. This is in my paper, right? This is extraordinary. They published, these are doctors didn't know about this. I didn't know about this. We should have been told, right? Every doctor should have had that in their consultation room. It becomes part of the differential diagnosis when a patient comes in with one of these conditions, especially if it's a little bit odd. And then, is that 1 in 800 figure an underestimate? Is it higher than that? I think it probably is, and I'll tell you why. The clinical trials are often designed, drug companies rig their trials quite often. They design them so that they are going to get the least amount of side effects. So they pick people who are low risk of side effects. They can figure out, right, healthier people, for example. So that's one reason why the figure is lower. The other reason is it was only 2 months. We know that vaccines can cause harms after several months. My dad's was 6 months later. There's been autopsy studies done showing even 4 months after having the Pfizer vaccine conclusively that the vaccine killed people, right, from autopsy studies. People 4 months later, right? So we know that this is likely a gross underestimate. So what else could it be? Now, there was an interesting publication only a couple of weeks ago in BMC Infectious Diseases, and they used a survey in America asking people who knew of people who felt they were vaccine injured, right? Trust the patient, okay, right? And they came up with a figure which is just extraordinary, but probably closer to the truth. And they estimated that in the United States alone in 2021, there could have been 278,000 deaths because of the vaccine and 1 million serious adverse effects, which basically translates into 1 in 300 and 1 in 1,000 for death. Right? Remember those figures earlier about preventing hospitalization. And the mechanism of harm is that the spike protein from the vaccine and the lipid nanoparticles, we thought, like other vaccines, those are obviously dead viruses or attenuated viruses. They stay in the arm. You generate antibodies. Thank you very much. these unfortunately appear to be distributed throughout every organ system in the body for up to even 4 months or longer. And that means they can either cause a direct toxic effect in the brain, the heart, the kidneys, the liver, the ovaries, the testes, or cause an autoimmune reaction. What about observational data? Israel published a study in Nature Scientific Reports, and they found that this is really quite shocking. This is the saddest part, the young people that are dying here. They found there was a 25% increase in Israel of cardiac arrests and heart attacks in people aged between 16 and 40, right? Associated with the vaccine and not associated with COVID. Okay, most people here are familiar with COVID Shield, and a couple of months ago, I was invited, Barka Duck contacted me on Twitter. I think she saw some of my work and wanted to interview me about the vaccine. And she said, and what's interesting, when she called me, she said to me, Dr. Malhotra, there are anecdotal reports in India of increased heart attacks. So we're going to, and I said, that's interesting. Okay, what's going on here? And I said, and I was surprised because I was under the impression, I didn't realize COVID Shield was AstraZeneca. I'd heard about COVID Shield and Covaxin. I thought they were they were original sort of based upon traditional vaccines. I didn't realize it was AstraZeneca. And then I looked at it and I thought, what the hell happened in India? Because we suspended, in most European countries in 2021, right? Despite all of the media capture, which we'll come on to in the political capture, it was so bad, the side effects, that they were suspended in most European countries. Your COVID Shield vaccine was suspended because of harms, because of serious harms. In the UK, we stopped using it because there were 800,000 reports of adverse effects on the yellow card scheme after 9.7 million doses. It's almost 10%. So what happened in India? Why was it rolled out here? I don't know, right? Most people didn't, COVID Shield, the name, it wasn't AstraZeneca, it wasn't obvious. This is, one well-known presenter, a BBC journalist who, I've been in touch with her husband, very sad case. And it was the coroner, concluded that she died because of the AstraZeneca vaccine. She had a clot in her brain. And this is the thing. Now, I haven't got the same level of data for, COVID Shield in terms of benefits and harms that I do for Pfizer. But one of the interesting things is when you look at the benefits of the COVID Shield vaccine, AstraZeneca, in terms of prevention of infection, it was similar to Pfizer. That 1 in 119 figure, right, at the beginning was similar to Pfizer. But in terms of harms, June 2021, there was a publication that looked at the adverse effects comparing AstraZeneca or COVID Shield and Pfizer, and it was worse. It was worse than Pfizer. And what they found was we compared severe adverse events, frequency after vaccination with virus-based vaccines, etc., higher coagulation disorders, arterial, cardiac, and nervous system side effect frequency, and they found that the serious adverse event related death frequency was higher with COVID Shield than it was with Pfizer. Okay, so I think, I'm hearing all these reports. I've been speaking to people in India since I've been here, and I think what needs to be, and I've said this before with Pfizer, I think all unexpected strokes, cardiac arrests, heart attacks, right, that are happening in people or in India is because of COVID Shield until proven otherwise. Yeah? I think we have to start getting people to think that way. Until proven otherwise. It doesn't mean there aren't other causes. The default thinking now has to be this. That has to be the way we approach this. So what's at the heart? Let's go the causes of the causes. I'm getting towards the end of the talk now. So what are the causes of the causes? So you have to understand something called the commercial determinants of health, right? So these are strategies and approaches adopted by the private sector to promote products and choices that are detrimental or damaging to health. And you can apply this to the food industry, right, with ultra-processed food and the way they market foods as healthy when they have the opposite effect on your health, for example. And of course, these are big drivers of what happens downstream in terms of people's health. But how do big corporations, how do big pharma and big food, how do they exert their power over health policy? And this is, again, you won't be able to see it all here. I'll just take you through it briefly. So this is from a paper in 2018. But if you look at the upstream effects of their power, it has a downstream effect on what happens in the consultation room, what happens to population health. So they exert their power in 3 different dimensions. A one-dimensional view is power over decision-making and control of the political agenda. So they lobby politicians, they can donate money for campaigns to politicians, for example, right? And that can obviously affect policies, right? Mandates, all that stuff that we saw was nonsense. Preference shaping, right? Capture of the media. In the United States, 80% of the media is owned by 7 big corporations, essentially, okay? Broadcast and print media. Philanthropic organizations, the Bill and Melinda Gates Foundation. Yeah? Okay, Bill Gates heavily invested stocks in McDonald's, Coca-Cola, and the pharmaceutical industry. He's the second biggest funder to the World Health Organization. Margaret Chan, the former director of the WHO, only recently said 70% of the funding from the WHO now comes with strings attached, right? When I was doing my investigation on sugar, I'm known in the UK as well as being, bringing about a sugary drinks tax and highlighting the harms of excess sugar. When I was doing my investigation there, and we ultimately influenced the WHO, by the way, to change their guidelines, I found that in 2003, the World Health Organization was about to do a big announcement saying sugar is actually, the amount of consumption of sugar is very harmful across the world, and people need to reduce their sugar consumption, right, on the data that was available at the time. And they didn't do it. You know why they didn't do it? Because George Bush's government, the American government, threatened to withdraw funding from the WHO if they did that because they were getting lobbied by Coca-Cola. Right? So this is a big problem. This is a really big problem. They influence the knowledge environment, so they fund medical education. They fund most of the drug research now. Drug research is pharmaceutical industry sponsored, and we know that that exaggerates the benefits and safety of medications. The legal environment, okay, limit liability, threat of litigation and preemption, unregulated activity as well. So they influence the legal environment, and then they have the extra legal environment, opposition fragmentation, okay, tax evasion, opposition fragmentation. What that means is they target public health advocates, they smear them, they deplatform them, they harass them, people who call out, their misdemeanors, right? And this is how they do it, and this is how they exert power, and it has a massive impact. And, most people aren't aware of these problems, right? So, they also have this three-dimensional view, the power to avert conflict and keep conflict hidden or latent. You're not hearing about in the mainstream media because they are controlling the narrative, right? And that is keeping conflict between the interests of the powerful and those over whom power is exerted hidden. Because if something becomes a public issue in the mainstream, you are here, you're enlightened, right? You're angry, you want to do something about it. Imagine if everybody was aware of what you're aware, right? The industry do not want that to get out, that truth to get out, right? The general population don't know what's happening, and they don't even know that they don't know. So corporate power needs to be a public health priority. And just to give you an example of I think, probably what's happened, right? I think probably what's happened with Pfizer, maybe even AstraZeneca, is I think they knew when it was rolled out. Vioxx was a drug that was promoted in the early 2000s, and it was found, Merck was a drug company, they were found to have committed fraud, and they were fined $950 million in 2011. And when the litigation was going on, because it ultimately caused about 60,000 heart attacks, it doubled the risk of heart attacks, internal emails revealed that the chief scientist of Merck had basically said, in an internal email, when the drug was being approved, it's a shame that the cardiovascular effect is there, but the drug will do well and we will do well. What do you call that kind of behavior? Right? Well, yeah, somebody said it already, got it correct. Psychopathic, right? It is. And actually, this is not me being inflammatory, right? This is evidence-based opinion here. This is from Robert Hare, forensic psychologist, who says often drug companies and big corporations, when they conduct their business, they behave like they fulfill criteria for psychopathy. Callous, unconcerned for the feelings of others, reckless disregard for the safety of others, deceitfulness, repeated lying, and conning others for profit. That's what we're talking about. And Anthony Fauci kept talking about trust the science, right? Trust the science. Trust the science, the most unscientific statement I've ever heard. What he meant in effect, although I don't think he deliberately meant this, but in effect he was saying, trust the psychopath. And that has been a very, very bad idea, hasn't it? And then social media, deplatforming, censorship on social media. Facebook partnered with Merck, the same company that was responsible for the Vioxx scandal, to control health misinformation on their platform. And then, of course, I've also suffered, we've all suffered, but, that's part of life, unfortunately, but I've also suffered. I lost both my parents because of failing healthcare system, because of misinformation, health misinformation. My dad had an ambulance delay that caused his death, ultimately, before, obviously, the vaccine caused a cardiac arrest as well. And, we're all interconnected here, and it's our duty to make sure we change the system for the better so that everybody is in a better place than they have. You know, this affects all of us. And we have to tell our policymakers, our politicians, and the Bill Gates of this world, we have to make them also understand that ultimately, unless they are part of, you know, unless they are part of the solution, they are part of the problem, and there will be no solution. How do we do this? I'm just finishing up. I know we've got a few minutes left. Okay, so strategies here, and this is something I've been doing over 10 years. It's called the triangle that moves a mountain. You create the relevant knowledge, okay? You disseminate that knowledge to the public, either through mainstream or social media, or through the social participation movement here. Awaken India movement is just fantastic. I mean, very inspiring, by the way, very inspiring. And then, yeah, absolutely, you know, kudos to you. Kudos to all of you. And then political involvement, we get the politicians involved who listen to the public and through the mainstream media. And then we've had a few successes, right? But with successes, you know, Jordan Peterson, the clinical psychologist, said that if you're a warrior, right? If you're a warrior, and we're all warriors here, you've got to expect that you're also going to get hurt, right? And that's fine. That's part of life, right? But it's worth it. It's worth it. So we had a big success. I managed to get on the BBC. I mean, I've done lots of stuff for the BBC, but on the vaccine, they weren't having any of it, even though I know lots of journalists who are on my side. And they asked me about statins, and I subtly brought in this discussion of the vaccine, which has got like 23 million views, okay? And then, when I was invited here, and by the way, big kudos to Johan, to Krisha, and Mole, and all of you that have made my trip, you know, happen. What can I give back to you, right, is at least let's try and break the mainstream. And I sat there, and I used all of my experience and knowledge, and I created a press release, and I sent it to the Indian Press Association, and we managed to break the mainstream media, right? This is because of you, right? This is because of you. I'm just a medium. I'm here to help you along. This is all your work, right? And this helps. It does help. It does help. But we have to also realize in this process, right, public health advocacy, that, you know, how do we approach this with doctors? Well, doctors need to realize when we make mistakes, we admit we've made mistakes, and our patients trust us more, and we move on, and we understand what's going on. And at the moment, the longer they are in denial, the medical establishment, the worse the problem is going to get, right? And there are lots of, you know, media attention on a public health issue is going to be more effective often than private advocacy, but we keep doing both. It's really important. But also, you have to grow a rhinoceros hide when you're a public health advocate, right? Because as soon as your work threatens, as soon as your work threatens an industry or an ideology, you will be attacked. You will be attacked sometimes unrelentingly and viciously. And not long after that BBC News interview, that's it. The Guardian and the Times went from me. I was accused of BBC criticized for letting cardiologists hijack interview with false COVID jab claim, right? But for me, this is a sign of success. When I did my paper, I said, as soon as I get hit, I know we are winning, right? Gandhiji said, first they ignore you, then they laugh at you, then they fight you, then you win, right? So that's where we're going now, okay? So just finishing up here, there are lots of things that can be done from a policy perspective, but really what we need to do if we're going to win this battle, right? So the bottom line of public health, the field of public health medicine has to dissociate its financial relationships with the drug industry. No more, enough now. People are not getting independent information, and we're seeing how much damage that's doing to the population. Abraham Lincoln, this is something that, you know, the East India Company, British colonialism was actually corporate tyranny. That's what it was. That was really behind it. When America was founded, it was founded on the principles to dissociate itself from the East India Company, from British colonialism, from corporate tyranny. This has been going on for years. It's been, you know, peaks and troughs. And Abraham Lincoln said, I see in the near future a crisis approaching that unnerves me and causes me to tremble for the safety of my country. Corporations have been enthroned, and an era of corruption in high places will follow, and the money power of the country will endeavor to prolong its reign by working upon all the prejudices of the people until all the wealth is aggregated in a few hands and the republic is destroyed. So what do we do also as individuals? We have to change the culture, moving away from materialism, right? Back to what it means to be human. What does it mean to be human? More spiritualism. We put more value on emphasis on relationships, on honesty, on integrity, not on material goods. This is also a cultural problem, right? And that's what we need to think about. And Robert Kennedy, the late Robert Kennedy, he had it right. And I've lost my, okay. You know, Robert Kennedy also said this, that we need to put more emphasis really on children's education, the quality of their education or the joy of their play. So the gross national product does not allow for these, the health of our children, right? It does not include the beauty of our poetry or the strength of our marriages, the intelligence of our public debate, or the integrity of our public officials. It measures neither our wit nor our courage, neither our wisdom nor our learning, neither our compassion nor our devotion to our country. It measures everything, in short, except which makes life worthwhile. Let's go back to remembering basic values. The most important thing is we have to act virtuously, okay? Ancient wisdom, Socrates, the Buddha, this is what we're talking about. And of all the virtues that we have to think about when it comes to our own behavior, courage is the most important of all the virtues, because without courage, you can't practice any other virtue consistently, okay? And Gandhi said, he said many beautiful quotes. One of the things he also said is, even if you're a minority of one, the truth is the truth. We're no longer a minority of one. We are an army, and we are growing. And we are going towards a new world order here, right? But he was right. It is health that is the real wealth, not pieces of gold and silver. Let's keep going. Let's rise up against this organization of misery. And remember, we need to keep shouting and making noise, because right's only won by those that make their voices heard. Hope is never silent. Thank you very much. Thank you.
Thank you, Dr. Aseem. Very, very, very good lecture. And thank you for enlightening us. A full house for you. Thank you. Screen ऊपर ले लीजिए, please. अभी आप लोग ने देखा होगा 7th को दिल्ली में प्रोग्राम था. सो दिल्ली में हम सब गए थे उधर. काफ़ी लोग यहाँ सामने जो बैठे हैं, तो वहाँ पर देवेंद्र बलाला जी ने मेरे को कैप्टन हैडॉक बोला. तो कैप्टन हैडॉक के साथ कौन रहता है? टिनटिन. तो हमारा टिनटिन कौन है अभी? जोर से नाम बोलिए. तो देखिए, योहान अपना बहुत अच्छा रिसर्चर है. वो जो भी रिसर्च करता है, आप लोग बिंदास उसको यूज़ कीजिए सब जगह पे. मैं तो रेगुलर यूज़ करता हूँ उनका, लेकिन एंड में खाली लिख देता हूँ, ये मेरे को योहान ने दिया है. सो कुछ गड़बड़ है तो योहान का गड़बड़ है. नीलेश सर शायद वो नहीं लिखते हैं, सर लिखना पड़ेगा. तो विदाउट डिले, योहान टेंगरा.
थैंक यू. थैंक यू. मेरा टॉक अभी नहीं है, खाली थोड़ा इंट्रोडक्शन और टाइम पास करने के लिए आया हूँ मैं यहाँ पे. तो देखो, पहली बात तो अभी डॉक्टर असीम ने बहुत अच्छा मेडिकल लेक्चर दिया हम सबको. थोड़ा बैक स्टोरी बता देता हूँ कि हम लोग कनेक्ट कैसे हुए एंड हाउ वी एक्चुअली केम डाउन हियर. तो रुशिल को पता होगा, हम लोग कोर्ट में बैठे थे एक दिन, और I'd got your number from Dr. Tess Lorry. So मैंने आपको मैसेज करने की कोशिश की थी, and then Dr. Aseem did not reply. So I thought यार, मतलब if he comes with us it'll be a very big thing, because ये इंडिया से ही है और यहाँ पे इनको बहुत लोग सुनेंगे अगर इनकी आवाज़ हमारे मूवमेंट को एम्पावर करेगी. So I was a little disappointed. फिर हम लोग, आशुतोष जी अपना कार्यक्रम प्लान कर रहे थे पीटर मैकॉलो के साथ, तो हमें लगा चलो कॉल दे देते डॉक्टर असीम को एक. तो आशुतोष ने डायरेक्टली व्हाट्सएप पे कॉल कर दिया एंड देन वी स्टार्टेड टॉकिंग. सो आई वुड जस्ट लाइक टू से कि इनका इम्पैक्ट दुनिया में, इन्होंने जो किया है, मेन स्ट्रीम मीडिया में गए हैं, BBC पे, फॉक्स न्यूज़ पे, और ये उन्होंने अभी नहीं चालू किया है, मतलब खाली वैक्सीन के मुद्दों के लिए इन्होंने अभी चालू किया है, बट काफ़ी साल से, ऑलमोस्ट 5-10 साल से पब्लिक हेल्थ इश्यूज़ के लिए कैंपेनिंग कर रहे हैं. चाहे वो हार्म्स ऑफ शुगर हो, चाहे वो फार्मास्यूटिकल इंडस्ट्री कैसे स्टडीज़ को मैनिपुलेट करती है हमारी हेल्थ को हार्म करने के लिए, ये सब चीज़ पे डॉक्टर असीम मुझे सबसे अच्छे क्यों लगते हैं, बिकॉज मैं जो अपने लाइफ में करने की कोशिश कर रहा हूँ वो बहुत बड़े स्केल पे कर रहे हैं. बिकॉज वो अपना डीप रिसर्च, जो वो मेडिकल बैकग्राउंड से आते हैं और उनका जो साइंटिफिक बेस है, उसको वो कंबाइन करते हैं एडवोकेसी के साथ. और जब ये दो मिल जाते हैं, डीप रिसर्च और एडवोकेसी, पब्लिक अवेयरनेस, तब जाके उसका इम्पैक्ट इतना बड़ा होता है कि उसमें मूवमेंट्स क्रिएट होते हैं, लोग शामिल होते हैं, अपने राइट्स के बारे में समझते हैं, और फिर एक टारगेटेड कॉन्सेंट्रेटेड एफर्ट होता है इश्यूज़ को ओवरटर्न करने के लिए, कानून बदलने के लिए। तो इन्होंने यूके में भी जो बुरे फूड है, पैकेज फूड्स है, शुगर है, इन पे टैक्स लगाने के लिए इनका बहुत बड़ा योगदान रहा है पॉलिसी मेकिंग में। तो आप सोच ही सकते हो कि वैक्सीन के इश्यू के लिए इन्वॉल्व हुए हैं तो दुनिया भर में बहुत बड़ा इम्पैक्ट कर रहे हैं। तो डॉक्टर असीम बहुत ही हम्बल है, और जैसे उन्होंने बोला, इनकी वजह से पूरे मेन स्ट्रीम मीडिया में आज ये बात चल रही है कि कोविशील्ड एस्ट्राजेनेका से भी बुरा है। मतलब ये पूरे वर्ल्ड इकोनॉमिक फोरम में जो फाइजर के सीईओ का ग्रिलिंग हुआ, उसके बाद इंडियन मीडिया कॉन्स्टेंटली ये नैरेटिव चला रहा था कि फाइजर इतना बुरा है, देखो मोदी ने इतना अच्छा काम किया, फाइजर को एंट्री नहीं दिया भारत में। बट एक्चुअली हमें भी सच्चाई पता है कि कोविशील्ड काफ़ी खतरनाक है, और कोविशील्ड की वजह से दुनिया भर में बहुत लोग मरे हैं, काफ़ी देशों में बैन हुआ है ये। तो वो सच्चाई को आगे लाने के लिए डॉक्टर असीम मल्होत्रा ने बहुत बड़ा काम किया है, और उसी काम को अभी हम लोग आगे लेके जाएंगे। थैंक यू सो मच डॉक्टर असीम। अभी हम लोग एक छोटा सेशन रखेंगे 10-15 मिनट का, जहाँ पे मेरी दोस्त है कृषा शाह, वो डॉक्टर असीम को कुछ क्वेश्चंस पूछेंगे आपके बिहाफ पे। तो थोड़ा कृषा को इंट्रोडक्शन दे देता हूँ मैं। तो कृषा एक्चुअली बहुत ही इम्पॉर्टेंट पिलर रही है अवेकन इंडिया मूवमेंट में। जब हम लोग शुरुआत में अवेकन इंडिया मूवमेंट क्रिएट करने की कोशिश कर रहे थे, तो तब हमारे साथ बहुत ही कम लोग जुड़े थे, बिकॉज बहुत ही कम लोग वो टाइम पे जो मैटर की अर्जेंसी थी उसको समझ रहे थे। उनमें से एक कृषा थी। तो कृषा आई हमारे साथ, हम लोग कुछ 7-8 लोग थे, और हम लोग ने काफ़ी मीटिंग्स किए, उसमें कृषा ने बहुत बड़ा योगदान दिया। वेबसाइट पूरी आज जो अवेकन इंडिया मूवमेंट की है वो कृषा ने क्रिएट की स्टार्टिंग में। हमारे जो क्रिस्प प्रेस रिलीजेस थे, जिसके वजह से हमें काफ़ी सारा मेन स्ट्रीम मीडिया कवरेज मिला, उनको कृषा ने ड्राफ्ट किया था। और कृषा और अनमोल ने दोनों साथ में मिलके हमें पीछे से बहुत सपोर्ट किया है, स्टार्टिंग से हर एक तरीके से सपोर्ट किया है। सो कृषा and Aseem, please come on stage. Everyone, please give a large round of applause for both of them.
Thank you, Johan. Thank you for that great introduction. And thank you, everyone who has taken the time to be here with us today. Awaken India movement is very, very close to my heart. My voice is shaking today because I'm so proud of how far we have come in this time. Apologies in advance, I have a sore throat, so in case I start coughing, just bear with me. Thank you, Aseem. Thank you for being here. It means so very much to not just me and Johan and Awaken India, but to all the people of India who may not already know what's coming up ahead. So thank you on behalf of your people, our country. Thank you. So I don't usually like labels, but if I have to describe myself, I would describe myself as an entrepreneur, an activist, a poet, a writer, and simply a human being. I come from an educational and professional background of political economy, social policy, development, human rights, and community building. Working with AIM and many other organizations and initiatives worldwide has taken up a lot of my time over the last 2.5 years. Activism and advocacy is very, very important to me, which is what really drew me to Dr. Aseem Malhotra. I have so much admiration and respect for the way that you have combined a professional career in cardiology and in medicine with advocacy and activism. Because as many of us here today know, activism sometimes has a bad reputation. People think activists are dangerous or crazy. They think they're unhinged. And I think people have a typecast that activists look like this. वो पागल लोग हैं जो रोड पे खड़े होते हैं पोस्टर वोस्टर लेके. But I think we're here to break not just one stereotype, but many stereotypes. Activists don't have to look a certain way. They don't have to dress a certain way. They can look like this, they can look like this, and they can look like all of you. I think part of what makes me feel very confident about being here and standing on this stage is the support from my family, from my husband, Anmol, from my parents, my mom, who's sitting right here with me, my dad, who's in my heart, my brother, who's here, my sister and brother-in-law in Delhi, my nephews, who are 3 and 5, who I'm really, truly fighting this fight for, and my in-laws and brother-in-law, who aren't here today, but who's supporting me in spirit. Thank you to all of you, really. I raise that point because in our conversations, Aseem, you've mentioned what a big impact your dad had on you and how he instilled and your parents instilled such strong values. Values of honesty, truth, integrity, courage, equality, justice. I think those are the pillars and the foundation upon which all of our efforts here are being built. Can you talk to us a little bit, Aseem, about why that's so important as we gather here today, especially under this banner of United We Stand? We are uniting on a foundation of values. We are not focusing on the differences of opinion. It may be that some of us believe certain things about what is going on right now over the last 2 years with COVID and vaccines. Some of us have, many of us disagree, actually, even within the AIM network and within other networks, even between Dr. Aseem and I, we may disagree on various points, but we know where we unite. We know where we draw a line, and we know where we need to come together. Could you talk about that?
No, really, really important points, Krisha, very powerful. I think the basic thing I would say is that, for societies, we want to all, ideally, we come back to this definition of health, we want to have optimal, or at least the best opportunity to have the best, optimal mental and physical health. And for societies to flourish, people have to be able to trust each other. And you can only trust each other when you believe that people are speaking the truth, when people are speaking the truth. So it all comes back to those basics. And even when you look at modern psychology or even, and combine that with ancient wisdom, even to lead the good and happy life, it does mean you have to come from a place of values, right? And certainly that's something that was instilled into me by my parents. In the UK, we have something called the 7 Nolan Principles. So this is something that all people in public life must adhere to. And these include politicians, teachers, doctors, police officers. And those 7 principles are these. And I remember when I worked for a health think tank called the King's Fund, we had to sign a paper, and I thought this actually is very, very good. And those 7 things are this. When you act in the public interest, you have to have these 7 principles. So selflessness, objectivity, integrity, accountability, honesty, openness, and leadership. And leadership also means pointing out when failures are occurring, when people are not adhering to these principles, right? So I think that if we come back to a place of values, it also comes back to trust and truth, and we can't flourish. As we see now, people are losing access to the truth. We see what's been going on with mainstream media, for example, increasingly losing access to the truth, and also a capacity for empathy. Right? And that then breeds violence. And that's a very, very bad state of affairs to be in, So we have to just come back to the basics of being honest and being truthful, and that's the way forward.
Thank you. I think that's an important point there about losing public trust. I think, a lot of people pointed fingers and blamed many of us here and around the world for saying what sounded like crazy things or believing things that were outrageous. But when trust is broken, you know, you can think about it like in relationships. If trust is broken, your mind can start conceiving and believing all sorts of things. So I only have empathy, and I believe it is fair that people maybe believe things that sounded crazy because our trust was broken. So thank you. Thank you for explaining that. Another important point I wanted to bring up is your fan following worldwide has great admiration for your courage. I know many of us here have been courageous from the get-go, but I think it takes a different kind of courage and humility to say, I was wrong, I changed my mind, and now my opinion has evolved. I should hope that many others will take your lead, and they would also be able to look back and say, it's okay to say I changed my mind. How would you encourage people to go on that journey, especially people like doctors, media professionals, organizations, even government entities? How do we encourage them to say, it's okay to change your mind?
Wow, that's a great question. Well, I think, yeah, well, in medicine, right, one of the things one slide I didn't put up is that we're taught in medical school that 50% of what you learn will turn out to be either outdated or dead wrong within 5 years of your graduation. The trouble is nobody can tell you which half, so you have to learn on your own, right? So I think that when mistakes happen, I think people just want people to come from a position of saying, honestly, I got it wrong, this is why I got it wrong, and then we implement measures to reduce the risk of that happening again. I think that's just should be just part of normal conversation, certainly with doctors as well. And then the other thing I think as well to emphasize is, you know, some of the so-called cover-up going on or whatever, or people that are aware but not speaking out, I think we have to explain to people that not speaking the truth is only going to cause the problem to get bigger and bigger. And then it becomes almost insurmountable, right? So, you know, it's not safe to speak the truth, but it's less safe to not speak the truth, right? So it's actually, when people say, okay, Aseem, you're brave, you're courageous, I don't think about it that way. I think it's actually, I'm actually being rational with what I'm doing. I look at it rationally. Unless I speak out and identify these root causes of these problems, the situation is only going to get worse. You can look at it just purely from a rational perspective as well. So I think it's having that dialogue, it's having those conversations. And I think you have to tailor your conversation to whoever you're speaking with. But, you know, there are different ways of approaching this. Unfortunately, we have this big division, certainly in America and the UK, of left and right. And a lot of these people that are promoting this narrative on our side tend to be coming from the right. I'm traditionally from the left. But I think when it gets into insults and name calling and whatever else, I don't think we progress any further. So we have to be better than the people who are arguing against us, right? If they go low, we go high, right? That's the way forward. We have to set an example of how we do this. And this comes even from Gandhi's teachings, right? Non-violence, even in your speech, right? That's how we set, people will respect us more. People may get angry, but we don't lose our temper. We keep calm. We keep telling them the facts. We're compassionate. That's how we win it.
Thank you. Yeah, that's something I worry about, you know, that when people get angry as they realize what's happened, how are we going to maintain coherence as a society? How do we make sure that it's love that rules and not fear and anger? And I think there's a fine balance there. So thank you for speaking to that. This last week has been such a fantastic series of events that has come together because of collaborations and strong relationships and new partnerships. I truly believe that community is everything. And the only way we're going to win this is if we can extend a hand, join hands, and form new strong relationships and associations. Can you talk a little bit about the importance of building strong relationships and partnerships as we try to build new, resilient systems for humanity? What role does collaboration play?
Oh, it's huge. I think even coming back to the basics of what it means to be human, we flourish better when we've got community, right? And this comes back to the basics of even survival and evolution, in that we feel protected when we've got people around us that, you know, we're there to look out for each other. So we go back to those basics first. And then the other thing is, when you are in this case, for example, the Awaken India movement, it's a very powerful, big, growing organization, but still the minority, right, against this big juggernaut. There is safety in numbers as well. Yeah. You know, if we are working in isolation, it's much easier for those people to be taken down, to suffer stress, to not be able to help advance the cause because they're on their own. But when you're in a group, you know, it becomes a synergistic effect. So I think that both from a human aspect of being in a community, but also in terms of creating that change that we need to see, it has to happen at the grassroots level through that community action and through those relationships. Absolutely. Very important.
Yeah, and I think Awaken India movement and the rest of us, including you, have done such a great job of making allies, not just within activism and health, you know, within creative fields and other kinds of fields as well. And we've seen a lot of growth and traction through that. Actually, even with Dr. Vandana Shiva and Navdanya, which is her organization. And my next and last little discussion point relates to a question which I asked her when we hosted her in Bombay about 6 months ago. And it relates to the confluence of science, spirituality, and activism. Traditionally, because I know, given that we're educated by a Western system, they've ingrained in our minds that religion and spirituality is contrary to science. And I think what you described as well in your talk is, this is a time when we need to bring it all back together. And I loved hearing what Dr. Vandana Shiva said and how she explained how quantum physics really is the same as spirituality. Could you talk a little bit more about what spirituality means to you, especially as someone who comes from a science and medical background, and also in terms of being not just any activist, but a conscious activist, being someone who's rooted in something higher, in something bigger than us, and how that's propelled you forward?
Wow, she asks tough questions, doesn't she? It's really, really good question. So, as I said in my talk, I think, you know, medicine is not an exact science, it's an applied science. So I look at medicine as an art and as the science of human beings. And therefore, you have to take the human aspect into every conversation you have when you're managing a patient, right? And the spiritual aspect of that is extremely important, because, you know, everybody has their own personalities, their own values system, and that has to be incorporated into thinking about how you manage that patient. Most of the best things we do in medicine actually is ultimately to relieve suffering, right? Which means you have to connect with people's minds and you have to connect with their hearts. And that is where the spiritualism comes. The Hunter Adams is a well-known American doctor who was involved in revolutionizing the doctor-patient relationship. And one of the lines he says is, you treat a disease, okay? Sometimes you win, sometimes you lose. But you treat a patient, you treat a person, you always win. Right? That's my approach to medicine, and that's how we should be teaching our doctors and medical students that application of scientific principles with the human aspect. And that does, of course, mean being spiritual. But even from, you know, psychological research, I mean, in the last couple of years have become very much, I've always been interested, you know, in philosophy, but I've got very heavily, deeply, you know, reading books, Hindu texts, Hanuman Chalisa, and even Buddhism as well. And you know, what that has, and I've done that partly through my own suffering. You know, I've lost all my immediate family. I've had to look for meaning in life and everything else in a different way. And, you know, a lot of those ancient wisdoms make a lot of sense, that one is suffering is inevitable. You have to grow from suffering. But that also gives us the ability to be more empathetic with our patients as well. So I think spiritualism is ultimately, you know, placing a value on things that, so I'm digressing a little bit here. What I was wanting to say is, I'm very interested in psychology, right? What is giving us the best mental health? How do we live the best life? How can we be as happy or whatever? And modern psychologists, very interesting, very eminent modern psychologists independently, all come back and cite the Buddha when they talk about mental health, right? So that spiritualism is at the heart, actually, ultimately, beyond any science, of what is going to give us the best way of leading our lives, right, away from materialism. So I hope that answers the question.
Thank you. I could ask a million questions.
And we teach our patients and we talk to patients about that, right, as well.
Yeah. And I experienced that firsthand as well in times of suffering. But I won't take too much more time, although I think we'll do a 2-hour segment on another day. There's a lot of very, very important updates to be shared by all of our frontline warriors. So thank you for giving us the stage. Thank you for your time. And thank you, Dr. Aseem.
Thank you. Thank you.
Guys, please sit. बैठो थोड़ा ट्रिविया खेलते हैं अभी. कोई मुझे बताएगा